my resignation pretty much was triggered by what the Minister of Health, Mr. Chebat, had said last week. I think it was Wednesday or Thursday, when he said publicly that the Board of Governors of the coalition have to step up. And although some people have approached me to tell me that I perhaps don't know what the meaning of step up means, I think any very reasonable person would say that step up means that you're not doing your job and you need to do better, and that the Ministry of Health is doing its part, and it's the fault of the fault of the board why things are not as good as they could be. No, I was very much shocked, upset. I'm still am. I would understand, for example, if somebody else had said it publicly, or the opposition, because there's a lot of mischief in there. But when it came from Minister of Health, who's supposed to be the team leader within the public health system, I found that very much insulting and untrue. And then the other part to this is that the following day, when I had to actually instigated a discussion amongst the other board members, it was clear to me that some of the board members were more in favor of protecting the minister and saying, you know what, we shouldn't say anything in public, and we shouldn't give the impression that we are fighting with the minister. And I said, well, it's the minister that said something that is not true and insulting to the Board of Governors. So those are pretty much the two things I said, you know what, I can't work in their system again. I tried to do my best. It's not out of haste, believe me, it's not out of haste, but the leaders, the politicians have to realize that they are not immortals, and they are answerable to the people. And I am also want to make everybody realize that the exclusive goal of the Ministry of Health is to serve the people, not to serve anybody else, and to be involved in any rift that compromises the healthcare delivery system, because there's more to meet the eyes as what's going on with the system. No, there's more, and I know they will come and say that that's not true, and I don't have paper proof to it, but I know that there's a lot of rift, and a lot of, and this isn't for this particular administration. This is a chronic problem, and the opposition would dare not even try to make this a political one, because they are even more guilty, because they have been handling the ship for the past 12 years. And the whole purchasing of pharmaceuticals and supplies, that were a hustle, basically, and has been a hustle with the Ministry of Health. And it's time that somebody, and I don't know, the Accountant General or what have you, the public at large, to look into these things so that monies can be well spent.